There was actually two people who influenced me to become a pharmacist. One was a girl that I was going to school with. She was just a few years ahead of me, and she was doing the pharmacy track. So she was talking to me about what a pharmacist does and things like that. And so I was able to follow her footsteps. And then after that, I actually had three students from my high school follow the same footsteps as me too. So went to a small school, and then we had about 20 people graduating each year. So it was cool to see that come from a small town. I started having allergies in high school, and I went to my local pharmacy at the time and asked about what I should be doing, if any of these meds work, etc. And the pharmacist there was just so knowledgeable about what I should be taking, ask good questions, and I was like, I think this is something I could do, and I would really like to talk to people in this way and get to know people in this way. I was very impressed by his expertise and wanted to follow that career path. I have a couple of different hats I get to wear here at Reedsburg Area Medical Center, which I like it that way. It keeps my days very interesting. So typically my week is on Mondays. I do chronic care management, where I meet with patients who take a lot of medications and help them manage their many conditions every single day. On Thursdays, I do diabetes education. So for diabetes education, we meet with people with prediabetes, diabetes, gestational diabetes, and talk about how they can manage it, help them know more about their medications, figure out how to test their blood sugars, and just overcome any problems that they might be having with their diabetes. On Tuesdays and Fridays, I get to work at Viking Pharmacy and meet new people and talk to people about their medications and help them overcome insurance issues and other things like that. I really like getting to know my patients on a personal level and then just helping them make little tweaks that make big impacts. Especially with medications, there can be side effects that people have dealt with for years, and when we talk to them and tell them about the side effects and figure out a way to try a different medication or take it at a different time, and then they have a huge difference in their quality of life, it's just really rewarding to me. I knew a couple people who worked here who were pushing on me heavily, and that made me look at the facility. I was familiar with a couple of the things that they were doing just because I worked actually at a different place with them on a couple different projects, and the innovation was the biggest thing. I wanted to do cool new things in pharmacy, and that was what I get to do here now every day, so I'm excited to be here. I'm a dad, and I have 3 kids right now who we spend a lot of time going to the Mirror Lake State Park, going to the beach. We go to a lot of the parks and the splash pad and a lot of the different things in Reedsburg we really like doing. Other than that, I like to work with my hands. Unfortunately, in my job, I don't get to do that as much, but I've done a lot of construction work, woodworking. I do some 3D printing on the side, so a little bit of everything I get my hands into.